Hi everyone, today I'm going to talk about cardiometabolic syndrome, or CMS, a growing health issue that affects people around the world. This condition includes a group of problems like high blood pressure, high blood sugar, and unhealthy cholesterol levels, along with excess fat around the waist. Together, these increase the risks of serious diseases such as heart attack, stroke, and type 2 diabetes. So what causes CMS? Well, the biggest factor behind CMS is visceral fat, which is a fat stored deep within the belly. This kind of fat is active as it releases harmful substances that cause inflammation and increase blood clot risk. CMS also involves insulin resistance, which means the body doesn't use insulin properly. And this can happen when there's too much free fatty acid in the blood or when the body has fewer healthy mitochondria, which are the parts of the cells that make energy. Another key player is adiponectin, a protein made by fat cells that protect the heart and lower inflammation. People with CMS often have lower levels of this very useful protein. So what specifically makes CMS so hard to treat? Well, treating CMS isn't easy because it includes many different health problems. Doctors try to control each part, like blood pressure, cholesterol, and blood sugar, but that tends to not always be enough. Lifestyle changes like diet and exercise are always going to be the first line of defense. Just 30 minutes of fast walking each day can reduce CMS risks considerably. These changes often work better than some medications for preventing diabetes, but not everyone responds the same to these treatments. Some people may need weight loss surgery, especially if they're severely obese and don't get better with medicine or through diet changes. And this surgery still does come with a lot of risks, particularly for older patients and those with other health issues. And so you might be wondering, why does CMS matter globally? Well, as of 2014, around 1 in every 4 adults worldwide had CMS, and that number just continues to increase each day. And that's a pretty significant number. It's also not just a personal health issue, but rather also an economic one as well, as people with CMS need more doctor's visits, more medications, and they miss more work days. For example, someone with all 4 CMS risk factors can cost over $12,000 a year in healthcare. In the US alone, CMS-related conditions costed over $80 billion in 2014. This makes CMS not just a medical concern, but a public health and financial crisis. In summary, cardiometabolic syndrome is a serious and complex health issue that combines obesity, high blood pressure, insulin resistance, and more. It raises the risks of heart disease, and diabetes, and comes with a high cost, both to individuals as well as society itself. The good news is that we can fight back with better food choices, regular exercise, and public health programs that target all parts of the syndrome, not just one. CMS is a challenge, but it's one we can face all together with the right tools and a proper team-based approach. Thank you for listening. Have a wonderful rest of your day.